Hello, everyone. Welcome to today's in-service. We're going to talk about the patient experience, or as I like to refer to it, treating people with obesity with respect. It's also known for accreditation purposes as sensitivity training. My name's Pam. I'm a 53-year-old registered nurse and certified bariatric nurse. I'm also an individual who's had obesity since a child and who's undergone multiple forms of treatment for the past 39 years. In 2001, I had laparoscopic gastric bypass surgery. I've encountered all forms of obesity, bias, stigma, and discrimination. Without a doubt, nowhere is that bias more obvious than among our fellow healthcare professionals. Imagine going to your doctor for severe abdominal pain, learning that you have two large hernias, and then being told the surgeon will only operate after you lose 20 pounds. Now imagine you're having hip pain as a result of having increased your walking and swimming activity along with changing your eating plan, and you've recently lost 70 pounds. Your PCP sends you to an orthopedic surgeon for evaluation who interrupts you to say, your problem's your weight, nothing else. It's all your weight. A referral to a second orthopedic surgeon resulted in a diagnosis of scoliosis with a 60-degree curvature of the spine. She prescribed physical therapy and the pain subsided. These are just two patient scenarios described by Dr. Scott Kahan, a bariatrician who specializes in the treatment of obesity, and a recent interview with the Today Show. Let's talk about obesity. On June 19, 2013, the American Medical Association recognized obesity as a complex chronic disease. You would think this would make it easier for the 93 million people in the US with overweight and obesity to obtain treatment, right? Wrong. When people experience weight stigma or discrimination, they're at higher risk for depression, anxiety, low self-esteem, and substance abuse. On a physical health side, they are more likely to engage in maladaptive eating behaviors like binge eating and avoiding physical activity. This comes from Dr. Rebecca Poole, Deputy Director of the Rudd Center for Food Policy and Obesity at the University of Connecticut. Now let's look at a few patient examples. Meet Sarah. She's a 45-year-old mother of three. Sarah's tried diet after diet after diet, counting thousands of calories, only to lose 15 to 20 pounds and then regain 25 to 30. Sarah's embarrassed to discuss her weight with her doctor, as her mother's told her over and over she should just have more willpower. Well, what Sarah needs to do is ask for a referral to a bariatrician. Bariatricians specialize in treating the chronic disease of obesity, and they can and will help her develop a treatment plan right for her. Let's meet Safira. At 33 years old, Safira is determined to do what her doctor says she needs to do to lose weight. However, Safira already walks 12,000 steps a day and eats fewer than 1,000 calories. But her doctor told her to just eat less and exercise more, without asking her current intake and activity levels. Assumptions based purely on a patient's size without taking a thorough history and performing a physical exam can lead to life-threatening events. You need a physician who will work with you to customize your treatment. This is Claire. Claire has a strong family history of high blood pressure, diabetes, and obesity. Claire is scared. She doesn't want to take lots of medications like her father and sister, and she's extremely worried about her risk of developing diabetes. Dr. Salazar realizes Claire's strong familial history put her at an increased risk of developing obesity-related comorbidities. She and Claire are working together on a comprehensive plan, including anti-obesity medications and weekly visits with a registered dietitian to prevent additional weight gain. They have agreed if Claire's body is resistant to this treatment plan, she will be referred for bariatric surgery. How would you provide safe and effective care for Claire or any other patient having surgery? Proper equipment without having to go hunt it down, a proper size gown available without bringing the wrong one in first. This is Jeff. Jeff played an offensive line in high school and college, and lately Jeff hasn't felt so great, so he went to see his doctor. Jeff was surprised to learn the impact his weight has on his testosterone levels. Dr. Ellis has referred Jeff to a comprehensive obesity and metabolic health program to find the right combination of treatment for him. Within a comprehensive obesity and metabolic program, You have appropriate lifting help, appropriate wheelchairs, and furniture. Despite obesity rates of 22 to 38% nationwide, there are multiple misperceptions regarding individuals with obesity. We have faced a lifetime of blame and shame, being told our weight is all our fault. We've been called fat, lazy, stupid, and often much worse. A new international study shows that while many healthcare professionals recognize obesity as a disease, most people living with the disease are still not being treated. 8 in 10 people with obesity believe it is their sole responsibility to lose weight, and they wait 6 years after initial weight loss struggles before speaking to their healthcare professional. According to new global data from the Action IO study, which stands for Awareness, Care, and Treatment in Obesity Management, the study interviewed over 14,500 people with obesity and almost 2,800 healthcare professionals from 11 countries over 5 continents. What we learned: 71% of healthcare professionals believe people with obesity are not interested in losing weight, while only 7% of people with obesity said they're not interested. That illustrates a clear gap in perception regarding interest to lose weight. 81% of people with obesity had made at least one serious weight loss effort in the past, while healthcare providers believed only about 35% of their patients had done so. Claire, Sarah, Jeff, Safira, and millions of additional people with obesity are challenging you. First, a couple of questions. Have you ever made fun of someone with obesity? Have you ever laughed at a fat joke? Have you ever made fun of someone with cancer? Would you? What about making fun of someone with infertility or heart disease? If you've done so, you are working in the wrong field. Our challenge to you right now: look deep inside and think of your friends, family, and colleagues. Do you know someone living with obesity? Have you ever made fun of them, called them a name, rolled your eyes when they spoke of their inability to lose weight? Guess what? You are part of the problem. Research has shown that fat shaming doesn't promote weight loss. Doctors think they are being helpful, but studies show that when patients have a shaming interaction, they lose less weight than people who don't have those types of negative interactions. Research also tells us that while explicit bias against people with obesity is decreased, implicit bias is increasing. What this means is people aren't really changing their thoughts and beliefs. They're just keeping those thoughts and beliefs internal instead of sharing them with the outside world. You may be wondering how on earth we change the many forms of bias and stigma leveled toward our patients with the chronic disease of obesity. The answer: it begins with you. Obesity is a complex, chronic, insidious disease affecting millions of lives. Unfortunately, unlike the majority of disease processes, our patients wear their obesity for the world to see and are judged solely on their size. As healthcare professionals, we need you to help educate everyone on the following. Obesity is a disease. Multiple treatment options are available. There is not a one-treatment-fits-all approach. Blaming and shaming are not effective. In fact, they contribute to additional weight gain. It is unacceptable and will not be tolerated to make fun of any group of patients, including those with overweight or obesity. And for all health conditions, we focus on people-first language. For example, the patient with diabetes, the patient with obesity, the individual with reflux, not the diabetic, the obese, or etc. So just like there are tons of healthcare providers out there, including nurse practitioners, dietitians, bariatricians, surgeons, behavioral health providers, there are also tons of resources available for healthcare providers and patients. And I've listed several of those here. I really want to call your attention to weightoftheworld.com. That website takes you to a group of individuals that have shared their story of how their life has been affected by obesity, and it can be a valuable resource for your patients. As we close out the session, I want to make sure that you know how to stay up to date on current news, research, and trends in obesity research and treatment. Follow the hashtags obesity and bariatric surgery on social media. You can also follow me on Twitter at bariatricu. I want to leave you with a final parting thought. We as healthcare professionals and clinicians are not immune to the diseases and disorders we treat. I bet you were taught the same guiding principle I was in nursing school, the same one many of us were taught in Sunday school. Treat others the way you want to be treated. Change begins with you. Start right now by refusing to allow obesity bias, stigma, or ridicule in your place of work, in your home, or in your presence. Thank you so much. And if you have any questions, please contact me via email at pamdavismba@gmail.com. Thank you so much.